What happened in the gene of a younger woman that developed breast cancer?
For cells which rapidly multiply, like cancer cells, 'cause that's what they're doing, they keep growing and growing and growing. These drugs will target that fast growing cells. So you have that chemotherapy, and that's the one that causes hair loss. So a lot of time people think, see, so when I screen my patients for cancer when they come in, because I work in the A&D department, right? So we have everybody coming for everything, and so I have to be careful that I'm screening people. Maybe their symptoms are due to a cancer, and a lot of the time we're screening for changes that happen over a slow period of time.
Why is it that there is not earlier screening for prostate cancer? Because the minimum age is 45.
Right.
Why isn't there earlier screening for prostate cancer?
The advice is that at the end of the day, every decision is up to you, and it's completely in your hands, your health and your life choices. You're responsible for that, and the options are there, and we're very fortunate to have a system which can.
Hi. YouTube have two ways to push your channel. With that said, I'm asking you two quick favors. If you like what I'm doing and want to support my growth, please give me a thumbs up so that YouTube could send my videos out to like-minded viewers just like you. 2. I've noticed that 70% of you who have revisited this channel have not yet subscribed. Please hit that subscribe button. That way my channel will grow. And my promise to you is to give you more content with substance just like these. Do we have a deal? Thank you.
Good evening again, guys. We are here with another episode of the Ivy Cancer Podcast. And my guest tonight is Dr. James Bell. Dr. Bell is currently a foundation year 2 doctor in Peterborough. James grew up in Birmingham and graduated from the Imperial College London in 2023 with an MBBS with distinction in surgery and a first-class honor BSc in gastroenterology and hepatology. During his time of Imperial, James sat on the interview panel for Imperial MBBS course application and volunteered as a tutor and an examiner for medical school mock exam. Outside of academia, James is keen on hockey, play, and violin. Welcome to the Ivy Cancer Podcast, where we discuss cancer, health, lifestyle, and healing. And today is no different. Now, James, I would like to say thank you for giving us the opportunity to come on this platform because it means a lot to me. As I explained to you, I started this podcast because I lost my mom to cancer. And one of the challenges I have is to get professional like you to give me interviews. And I want to say big maximum respect to Dr. Jackie Bell, who give us this contact, which is your mom.
Yeah.
I really appreciate that lady so much. She had a launch today, which I unfortunately could make it. But guys, please go and support her book. It's on Amazon. I will link the link in the description. It's more targeting children and their career path to choose. So big respect to Dr. Jackie Bell for this interview contact. You said that you in your bio that you are a hockey player. Why you choose that sport?
I was in school, and I, they made us play rugby, and I hated it. I hated the muddiness and the cold and wrestling with people. And so my dad said, "You have to play a team sport. You have to play a team sport." So I thought, okay, I'll try hockey. And yeah, it's great. I love it. Still play it to this day.
Hockey is that thing with the stick, right?
Yeah, the stick and the ball, not ice hockey, but on the AstroTurf.
Okay, okay. I think that sport is a bit dangerous, don't you think?
Yeah, it's dangerous. Just yes, last few days ago, my team coach he broke his finger. It just the bones in it got a bit broken from getting trapped with the sticks. But it's fun. Normally, it's fun as long as you don't as you're careful.
You know what funny? Like, we have to remember that even though you're a doctor, you have a life as well.
Yeah.
So this doctor, on I followed him on YouTube. His name is Mike, and
Mm,
his sport is boxing. Wouldn't
mm.
think that a doctor would pick up boxing,
No,
knowing the risk behind it, right?
yeah, exactly, exactly. No,
Yeah,
boxing is a
and
choice.
you also play instruments.
Yes, I played the violin mainly. I can play a little bit of piano, but mainly violin.
So is it a family thing because your mom played the music?
Yes, exactly. When
Oh,
we were younger, all the siblings playing, yeah, that was the.
okay, that's nice. So in the UK, around 56,000 people are diagnosed with breast cancer each year, which is about 150 people per day. This makes breast cancer the most common cancer in the UK, accounting for 15% of all new cases and around 2.3 million globally. Now, last year was my mom. I would think that she would be in this category of that 2.3 million. So my mom died of breast cancer, and as I said before, that is the reason why I created this podcast. So the majority of breast cancer occur in women over the age of 50. What happened in the gene of a younger woman that developed breast cancer?
So I'm sure you've already gone into it, but just for maybe people who haven't heard the early episodes about cancer and what's going on with the cancer, you have cells which are, the building blocks of the body, each individual cell, and inside each of these is some genetic material which you inherit from your parents, and it gets passed down, and there are some genes that code and they help stop cancer happening. So cancer is when your cells they multiply abnormally or they don't get terminated when they're being when they're behaving abnormally. So with breast cancer, there are some genes and they stop the tumors from happening. They get rid of the cells which are growing out of control. However, sometimes when the genes replicate, they don't always replicate correctly. And if you have a error in the gene, then it doesn't do the job properly and it doesn't stop the cells growing out of control. And that's what happens in young people with breast cancer. Maybe they've got a gene abnormality which is not controlling the cells.
I've learned about the BRCA one.
Yes, that's the one. Exactly. That's the main one.
Yeah, because my mom was diagnosed with the BRCA.
Mm,
Which what I've learned recently that all of us have BRCA gene in it.
yeah,
Is that correct?
exactly.
So it is a matter of the cell not responding to the BRCA gene and it create that tumor.
Right.
So I like to use I develop a terminology which I like to use, which a traffic light scenario. Whereas in Jamaica, we have some very, very disobedient drivers. It's not like here in the UK. So in the morning at the toll, you will have what 3 lanes of road,
Mm,
and the driver would use the soft shoulders, especially the taxi drivers and the bus drivers, and they will use the soft shoulder to maneuver through the traffic.
mm,
But there are times you will have police officers at either the ending of the toll, which they would stop these drivers and probably tell them to go back in the line, or
right.
they would give them a ticket depending on the, the police officers. But when that happened, it caused the traffic to build up more.
Mm,
So I like to use that terminology as the response with the genes. So you're saying that it is basically a non-communicative response between the genes.
Yes, so imagine the BRCA or the BRCA is what we were saying when we say BRCA.
Yeah,
That gene is like the police officer which will stop the bad driver.
yeah,
But sometimes if you have a faulty police officer,
yeah,
maybe
yeah.
they're gonna let the driver get past, and that's what's
Right.
happening with the genes.
Okay. Fair enough. I recently done a video on my YouTube channel regarding the BRCA. And like I said, I just recently know that all of us have BRCA genes inside of us. I always thought that it was just normal, cells that give that problem, but I realized that it is. What are some of the treatment that goes with the breast cancer?
Yeah, so there's a couple different ways, main ways that we use to treat breast cancer. So everybody knows about chemotherapy, I'm sure. And maybe some people aren't sure what that means, but chemo just means medication, drugs, okay?
Mm-hmm.
And it's probably a tablet regime. It can be other forms of medication, but often tablets. And these are drugs which kill cells, basically. They're cytotoxic, is the word. Cyto meaning cells, and toxic, obviously toxicity. So that's what we mean. And for cells which rapidly multiply, like cancer cells, 'cause that's what they're doing, they keep growing and growing and growing. These drugs will target that fast-growing cells. So you have that chemotherapy, and that's the one that causes hair loss. So a lot of time people see someone with hair loss and they think that's because of cancer. That's not actually because of the cancer. That's because
Because
of
of treatment.
the treatment, exactly. And then you have radiotherapy, which is when you use radiation beams.
Before you go to the
Oh
radio,
yeah, yeah,
chemo,
yes.
what damage the chemo actually do? Why people lose their hair? Is it damage to the hormones? What happened?
Yes, good question. So chemo, as um when I say it's cytotoxic, it's harmful to cells. It's not just harmful to the cancer cells, it's harmful to all cells in the body. Okay, so you'll get we call it systemic, which means all over the whole body side effects. And because it's damaging cells, it's causing harm to them. They're not going to work properly, such
Mhm,
as your hair cells or
mhm.
the cells where your hair is growing in. Um, they're not necessarily going to produce and replicate in a normal way because imagine your hair is constantly growing. That's sort of like the cancer cells. They need constant energy, and that's an easy target for the chemo drug to bind to. Um, you also have symptoms elsewhere from the chemotherapy, not just losing the hair. You can get ulcers in your mouth, you can have tummy problems, and that's all to do with the fact that these drugs are very harmful to human cells.
I in my knowledge, and I'm not saying to people, listen to me either.
Mm.
I am saying to people, just do your research and know what is good for you. But in my head, I don't think, even though some people it help while some it don't.
Right.
But I think people need to do their research before taking on chemo. But in my head, it's not something good.
Mm. And that's very reasonable because, as you said, sometimes it works and sometimes it doesn't. And it's very important that before people take it, they are given all the information regarding it and the side effects and the benefits and the risk profile. And that's something that's very important that people are aware of and make an active choice in. Because for some people it does work, for some people it works very well, and other people it doesn't.
Do you think it's a matter of the immune system, why it work with some and some it don't?
Yeah, it's in my opinion to do with a the type of cancer that people have. So some people may have a very aggressive form, which doesn't respond so well to the chemo, and some people might have a more mild form, which does respond well. Um, but also the fact that everybody is different. Everybody's bodies work differently and respond differently to medications. If I eat peanuts, I'll be fine, but somebody else might have it and they might
Right,
literally die from peanuts.
right.
So there's a big variation between individuals, in fact. So that's why it's important for every individual person to have their own conversation with their doctor about the risks and the benefits, and then decide, what they want to do.
I've done a few interview with some cancer survivor, and many of them have different testimonies where the chemo experience is concerned. One lose their toenail. She said that she was eating chips and she thought it was a chip that was on the floor, which was her toenail. And she had mouth sores as well. And the last interview I've done, I think I don't remember if it's the last one, but she had mouth ulcers as well, and there are a few of them I've interviewed, and they have different side effects. So, as you said, each person respond to the chemo differently.
Right.
What about the radiotherapy?
Right.
You was
So
about to explain the radiotherapy.
yes, radiotherapy is process by which radiation beams, so high energy beams, are targeted at the cancer cells. And similar to the chemotherapy, radiation is harmful for cells. It damages the way that they reproduce. And by targeting the cells in a particular spot, you can aim to reduce the size of a local cancer, a cancer in one place. Does that make sense?
So, in other words, in my head again, radiation would probably be better than chemotherapy. But when you have certain cancer, you would have to probably do both of them as well, right?
Exactly. Certain types will need, for proper clearance, different forms.
Oh, okay. Can people have recurrence of breast cancer?
Yes, so people can have recurrence of breast cancer, and there is, again, with the different types of cancer, different recurrence rates.
Mhm.
Um, it's oftentimes to do with the spread of the cancer. So if your cancer has spread away from the breast into the lymph nodes nearby,
Mhm.
or elsewhere into other organs, then recurrence becomes more and more likely. And so the further along down the line of progression your cancer is, the more likely you are to have a recurrence.
Because my mom, in her case, I would have shared the report with you, but I found one, and because of time, I couldn't find the next one. Because honestly speaking, I just started looking about it today. Because I never had the time in the week to look for it. But in her case, she had done a test before, and she was cleared. It was negative, and this was at a private hospital. But then she went to do a second test 6 months after, which is at a public hospital.
Mm,
That result, after going back and forth to the hospital, they keep saying to her, "It is not ready yet. It is not ready yet." However, by the time she find out that she had cancer, it had already spread,
mm,
and it was speculations at the hospitals that she had the breast cancer. They didn't went off any report, but based on the signs and the symptoms, they could say this is aggressive. And when
mm,
they start doing checks, it was at her lungs. She couldn't breathe. It was in her brain. Her eyes were swollen.
mm,
It was in her bone. It was into her um, kidney, liver. And
mm,
so it progressive so fast within a space less than a year. No, I can't remember, but I keep saying that it is negative breast cancer. But when what happened? This is just a question that comes on the top of my head. I,
mm.
I didn't even prepare for this, but what happened when a cancer is aggressive?
Mm. So when we say aggressive cancer, we're talking about how quickly it will replicate and how quickly it will spread. So there's different ways that we stage a cancer: by the type of cells that are in it, by how far it has spread, and whether it's in any lymph nodes. So an aggressive cancer is one that will very quickly um, change the type of cells, it will very quickly invade different spaces, as you said, unfortunately, very sadly in your mum's case, and it will, yes, it will basically move very quickly because a lot of the time in cancer we see a slow progression. So when I screen my patients for cancer when they come in, because I work in the A&E department, right? So we have everybody coming for everything, and so I have to be careful that I'm screening people. Maybe their symptoms are due to a cancer, and a lot of the time we're screening for changes that happen over a slow period of time. That to us is suspicious for cancer. But an aggressive form, as you said, is very rapid. And in those cases, we then move the test on very quickly
Mhm.
because we know that it can be, as you said, it can just be almost come out of nowhere, it can seem like.
Um, so all right. So we touch on the breast cancer. There's so much to basically cover when it comes to breast cancer because breast cancer is a wide thing.
Huge.
And breast cancer is in the top five of cancer that affects and unalive people. Um, but one of the thing is because I'm a male and I'm a bit concerned. You know, I had an interview a few weeks ago with a friend of mine. He operates a men's well-being group and one of the largest group known in the UK. And we spoke about prostate cancer. Now, prostate cancer, does that link with breast cancer in any ways? The reason why I ask is when men go for screening on their breasts, they tend to um, test their testicles. Is breast cancer linked with prostate cancer in any way?
Yeah, so that's another really good question. And the point that is important to convey here is that there is a connection that's been found in studies and research that people who have family history of a breast cancer can have a higher likelihood of a prostate cancer. So that means that out of the people in this study that they've looked at, out of all the ones that had prostate cancer, quite a large percentage of them had a family member or maybe themselves even that had history of breast cancer. So yes, and there is a link there. Whether or not that's a direct link is hard to say. So it's not a case of if you have prostate cancer, then you have breast cancer also, and vice versa.
Um, so I may be at risk then because my mom had breast cancer.
Mm,
Um, three of her brother had prostate cancer. She had a cousin with prostate cancer. She had a niece with breast cancer. And
mm.
she also have a next niece with a brain tumor. Am I at risk?
So, based on obviously the family profile, it seems like there was a family history of increased cancer rates. So, that would increase your risk of cancer. And it's important to say that it's when we say risk, it's your likelihood of having it, not necessarily that you do and you're guaranteed to. But
Mhm.
yes, it for those in your position or similar to your position would say they have a high
So
risk.
what would be your advice to me if I'm at high risk?
So very much get in touch with your GP or your doctor if you are concerned, and have a chat with them and see what if there's anything that can be organized. And I would also say be aware of symptoms and don't ignore them. So you know I'm sure you'll have heard a lot about some symptoms of prostate cancer, but things like difficulties urinating and stuff like that, those are all important things to pay attention to, definitely early on as well.
Um, as I said, we had the interview with Derek. Derek was his name, and we spoke a lot about um prostate cancer, but he's not a doctor.
Mm,
But he is knowledgeable on
right.
the topic,
Mm,
very passionate about,
yes. Yeah.
about it. And but on a doctor's perspective, what is prostate cancer?
Yeah. So prostate cancer, similarly to breast cancer, you're having these cells which are not obeying the correct signals about when they should terminate themselves or when they should stop growing basically, and they're growing out of control. And this happens within the prostate itself, which is an organ which sits inside the male pelvis, so in between your hips basically,
Mhm.
and just underneath your bladder.
So when you spoke about out of control, I remember my mom said that to me. You're getting out of control, boy, make a group. You know, I remember that she used to say that a lot. When I'm drawing out a line, she always said she's going to put me back in line. So it's the same thing basically. So
Right.
is it the case that all cancers start the same way with the disruption of the cell?
That's the vast majority of cancers. So in some cases, you have gene problems as well, as we've mentioned, and that means that the genes don't tell the cells to respond properly, and that's what it is. And to be honest with you, the majority of cases, there's some gene which is not doing its job to control the cells, either to tell them to die early or to stop them from growing as fast as they are.
Um, when I just start learning about cancer, like I've known about cancer for years. I've used to listen people who spoke about their loved one who passed of cancer. Used to see it on the social media, news, etc., etc. But I wasn't interested. And that is one of the reasons why I understand with people who, as friends, who are not even subscribed to my channel as yet, because it's not their thing. you
Mm,
know. So I can understand because I once was there. I wasn't interested. But since I lost my mom, I've become more in tune with cancer. So I've learned about the PSA test.
yeah.
And because I know that cancer is very much in my family, I was like, you know what? I'm going to request a PSA test.
Mm,
But when I called the doctor, they asked me my age and they said I'm too young.
mm,
Why is it that there is not earlier screening for prostate cancer? Because the maximum, the minimum age is 45.
right.
Why isn't there earlier screening for prostate cancer?
And do you know what? That's a is another another very good question, but another complicated one because the way that obviously in the UK NHS being publicly funded from the government means that they look at a balance of finances and resources, and they look at the likelihood of having prostate cancer if you're under 45, which I'm sure you obviously looked up the stats as about some papers estimate 1 in 350, some say 1 in 500 of men will have prostate cancer um, below the age of 45. And that's probably one of those 500 men who've been investigated for it. That makes sense. So the actual proportion of men who have it is even smaller. Um, so based on that probability, they will not routinely just do a PSA test without any symptoms. So if you had symptoms of prostate cancer, then they will say, okay, let's do a test for you. But without any symptoms, the cost of processing every single person who wanted a PSA test would be quite high. And that's why the NHS won't fund it.
But
That's what it comes down to.
but do you have to have symptoms though when it comes to prostate?
If you're under 45 and you want to have your screening done by an NHS organization, then they would not it would not be standard for them to say yes, we'll do a test. You'd have to probably, as somebody with a lot of history, in
Mm.
your case, I would expect that they'd be more likely to do the PSA test for you.
Yeah, because I had to say to them, listen, I need this test done because etc. etc. etc.
Yeah,
That's when they said, all right, come in for the PSA test, which
exactly.
was fine. It's
Exactly.
fine. And I think as Derek said to me, it's best for me to do a yearly one. So I think
Yeah,
coming this year, I would do a next one just to keep on top of things
yeah,
because
that's
listen, this
perfect.
thing called cancer, it is very, very serious. and if people can catch things at early stage, because statistically, people that catch cancer at an early stage have a more chance of beating it.
Exactly. Yeah.
So if people do their tests on a regular, whatever test it is, especially if you have um cancer in your family or you're at the age, I think people should do it. All right. What happened into the gene of a black man? Why black men are at higher risk of prostate cancer?
Yes, that's a good um point. It is known amongst healthcare providers, NHS healthcare professionals, that black men are more likely or make up a higher proportion of people with prostate cancer. So about one in 30%, and it's a case of basically not people not really knowing why. There's not a clear gene that's identified in black people, but it's been found that in black men, more aggressive cancers are found and they tend to progress more quickly, which might be part of the reason, but the actual cause is not known. Um, that's probably the best answer that I can give you at this
That's
point.
fair enough. Can we prevent prostate cancer?
So another good point. Can you prevent it? You can make lifestyle choices which reduce your risk of cancer. So there's some things which will have been shown to increase risk of prostate cancer, mainly smoking, as everybody I'm sure is very aware of. That is the strongest correlating factor to increasing your risk of cancer, and so is obesity. Being overweight, they found that that also increases your risk of developing prostate cancer. But other things such as you mentioned, your family history, genes, age, you can't change that. You can't stop that from affecting.
So, what are some of the lifestyle changes that we could basically use to help us lower our risk?
Yes. Best lifestyle changes are, I not smoking is the first one that everybody will hear. And if you're already not smoking, excellent. Managing your weight and obesity, so trying to make sure your body fat percentage is appropriate for your age and your height, and living a healthy lifestyle, avoiding foods which are going to worsen your health. So talking about fatty foods, high sugary foods, salty foods, that sort of stuff.
Is the same treatment for prostate the same as what for breast cancer?
Yeah, so again, similar arms. The only thing I say when I say arms, I mean strategies. So chemo, radiotherapy, and the only thing we didn't touch on with breast cancer was surgery. So in a lot of men, surgery will be a requirement, and it's called a resection of the prostate. Resection just means cutting away. But yeah.
Okay. What would be your advice to men when it comes to prostate cancer?
So my best advice is, as we said earlier, being informed, basically knowing about your treatment options and uh, your own risk, being aware of the fact that prostate cancer does affect a lot of men, and also not ignoring symptoms. So not just dismissing it and saying, no, no, I'm fine, like, there's nothing wrong. And, all that time spent waiting could have been, time spent actually treating something.
But some men going with the stigma behind finding out about prostate cancer, what would be the advice to them? Like, listen, they don't want to go to the doctors because some men do not want to feel anything up their bum.
Right, right.
You know what I mean? Some men have the notion that I rather not know.
Yeah.
What would be your advice to those group of people?
The advice is that at the end of the day, every decision is up to you, and it's completely in your hands, your health and your life choices, you're responsible for that, and uh, the options are there, and we're very fortunate to have a system which can do tests like that. Imagine across the world where they don't have blood tests available on hand or doctors available at the end of a phone call. We're in a great system, and this can literally save you, save your life, save years of your life.
Okay. Um, so no we touch because for me, like I just want to get the messages out. So I packed not just cancer into this podcast, so I hope you forgive me. I just
No,
want to touch because it is important that people really know about their health,
yeah.
right? So the WHO published a statistic in 2023 that 1.28 billion people from the age of 30 to 79 worldwide affected by hypertension. Why the number is so high?
Good question. The high blood pressure is one of the leading health problems that we face today, and it's largely due to lifestyle and diet. So imagine 100 years ago, there was no such thing as a salt shaker. You just pour it on to the fish and chips or whatever. There was no You had to work in the fields and grow crops to make a living or work in the farm, and the life adaptations we've had have gone faster than our bodies are used to.
Mm-hmm.
So we're now able to um, have foods and lifestyles which do not look after our bodies that well, to be honest with you.
Right.
That's the main reason.
Because one of the interesting thing um for me is that obesity plays a lot of part in a lot of illnesses, and hypertension is one of them. What other habits or what other risk factor why people develop hypertension?
Mm. So a lot of it is, as I said, diet. So people who have a high salt intake, that can increase your risk of hypertension. People who have sedentary lifestyle, so not very active, can lead you to develop hypertension. People who have also fatty foods in their diet can also develop problems with blood vessels and increasing blood pressure. Uh, so those are the main lifestyle reasons. Some people do have hypertension without necessarily having a high salt diet, and that can just come on for some people in a later age.
During my research, I've also found out that people can have hypertension and do not know.
Right.
Isn't that something serious? Like, I remember a few years ago, a friend of mine, very very young girl, went to bed, didn't wake up back.
Mm,
When they done the autopsy, they said her blood vessel burst in her brain. What happened there?
mm.
Is that related to hypertension?
So, I mean, it could be and it couldn't be. In some cases, people will have burst blood vessels without hypertension. So there are some conditions which can lead you to have more weak blood vessels called aneurysms in the brain, and it's a very tragic story. But in some cases, that can just be the case. Maybe a combination of factor. If you can have an aneurysm and you have high blood pressure, that might include your risk, but I would say that's quite rare.
Um, so all right. We 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 got to go. So back to the question when I asked, pertaining to not knowing if they have hypertension or not, and I asked if is it something serious,
Mm,
and bring that in because I thought it had something to do with it. But you not knowing that you have hypertension,
Mm.
is it serious?
To be honest with you, it depends on the time. So sometimes you can have hypertension and not have any side effects, but hypertension or high blood pressure can also cause problems. It can cause problems with your heart, it can cause problems with your vessels, it can cause problems with your kidneys. So if you've had high blood pressure for a long time and you've got to the point where it's causing damage across your body, particularly the kidneys, then yes, it can be serious.
So how could we know if we have hypertension?
Yeah, best way to know is to have your blood pressure checked, and especially if you're, as you said, you mentioned people over the age of 30. To be honest with you, people in middle age and older age in life, especially once you're around 50, you should be aware of what your blood pressure is, to be honest with you, at regular intervals, and just be aware that if it's high or if it's not, and seek treatment. Also, people who, if you have symptoms, if you have things like headaches or blurry vision or feeling dizzy all the time, it's worth, going to your doctor and saying, look, I'm having these symptoms. I don't know what's going on. I don't feel well. Can you check my blood pressure?
Is it important for us, for every, would you advise of every household to have a blood pressure machine?
I would say if you've been to a doctor and you've been told you have high blood pressure, then by all means go and buy a blood pressure machine. But for your average person who is normally fit and healthy, doesn't have any medical conditions, and is doing okay, there's no reason really for you to
But
give.
many of us think we are fit and healthy.
True, true. Many people think
Many
they're
of us think we're fit and healthy and we have so much things happening inside of us.
yeah, absolutely. That's a very
Sometimes you
good
hear
point.
some people just going about their business and just drop down dead. And you would
Yeah.
hear, oh, that man eat healthy, that man exercise, that
Mm,
man this, that man that. What happened? So, that's why I ask, because I don't like I do not struggle with hypertension. But
mm,
there are times, and I would classify myself as healthy because I do my exercise and I try to eat a balanced diet.
yeah.
But there are times if I'm over, especially if I'm overly stressed,
Mm,
I start feeling dizzy and I start feeling this, I wouldn't say burning sensation, but I feel this warm sensation inside my head. I can
mm,
say, you know what, my pressure is up,
mm,
And when I test, it is high.
mm.
But as you even speak about high, what is the normal measurement for the blood pressure? What measurement should we have?
Mm. So blood pressure is measured when in two phases, and you'll often hear one number of them. It sounds like a fraction, like 140 over 90 is the common phrase for hypertension. So that means that when your heart pumps, it has a phase where the blood pressure goes up. Imagine every time it pumps, the pressure is forcing, and that's the big number, the 140.
Mhm.
And then once the heart is filling up before it does another big pump, while it's being filled with blood, uh, that's when the pressure goes down a little bit, and that's when you have the second number, which is 90.
Mm.
So so hypertension is normally if you have a top number that's bigger 140 or a bottom number that's bigger than 90,
Okay. Um,
if that makes sense. I hope it does. If it doesn't, tell me and
no,
I'll
it
explain
for
it
me it does. For me it does.
better.
I understand what you're saying, and I think the community that watch and support my channel, I think they would understand as well,
Okay.
because a lot of these people that support my channel are in health,
Right.
so they understand. But I just want to squeeze in one more thing, please.
Of course, by
Um,
all means. Yeah,
and,
no
and
problem.
and that is diabetes.
Right.
And the reason why I want to put in diabetes because it's the first people going to hear us said this. I was diagnosed with pre-diabetic,
Mm,
and I will probably not be the first, but I don't. go into depths as yet, and I still won't go into depths as yet. But I am no longer in pre-diabetic, thanks be to God, and that was due to lifestyle changes. And I want you as a doctor to touch a bit on it where lifestyle changes is concerned as well. But what do we need to know about diabetes?
Mm. So, diabetes is when you have high blood sugar. So, just imagine you have a chocolate bar or a cake or something with very high sugar concentration, and it goes into your stomach, your body absorbs it, and for a brief period of time, the amount of sugar in your blood goes up. All right. And your body's response to that is to release a hormone called insulin, and insulin pushes that sugar back into the cells and into the muscle, and it puts it away out of the blood so your sugar level is normal. Now, there's different types of diabetes, but the principle is the same in that the insulin in type 2, let's talk about type 2 diabetes, that's the one that everybody hears about. Type 2 diabetes means that your body has gotten so used to the insulin always coming up because always having sugary foods that the body stops responding to the insulin, and it's called insulin resistance. And so now when you have the sugary food, the body ignores the insulin and the sugar stays high. Okay, that's what happened in type 2 diabetes. I'll just very quickly say type 1 diabetes is different, which is it's a condition where your body doesn't produce insulin by itself, okay? And that's something that comes on in childhood and you can't change that. Nothing about your lifestyle will affect that. But type 2 diabetes only comes on with lifestyle. So that's essentially what it is. The problem with having the high sugar, you wonder like, oh, what's the sugar going to do? The sugar is actually harmful to cells. It can cause damage. It causes damage to nerves. It can cause damage to the small blood vessels in your eyes, and it can cause damage to the blood vessels in your feet, and damage to the blood vessels in your kidneys. Okay, so um, that's why it's harmful to have that's why your body's always trying to put the sugar away with the insulin.
So that's why some people get blind,
Exactly. That's why some people have blindness from diabetes.
and that is from the type 2. Or
That can be from type 2 or type 1 because the problem is the same where the sugar is high in the blood.
so I'm not certain if I heard it correctly or I do not understand. But you mentioned about the type 1 and something to childhood. Can you repeat that and
Yes, of
explain it?
course. By all means. So type 1 diabetes is similar in the sense that you have high blood sugar, but the reason that the blood sugar is high is because your body is not producing the insulin. So you have a small organ, it's a bit like a little pancake in your body called the pancreas, imagine, and it produces lots of different hormones, but one of the ones it produces is called insulin. And that's the one I was mentioning that puts the sugar away, puts the sugar into your muscles and into your liver. And for kids who are, or not kids, but for people who are born and they don't have the ability to make the insulin, normally because of an autoimmune condition, autoimmune response that damages the cells just from the body itself, you don't get the insulin. The insulin is not even being produced. And those are the people who have insulin injections.
Why? What?
Sorry, let me explain. Do you want me to
Yeah,
ask me anything to
I'm trying
explain
to
it?
understand what happened, why the insulin is not being produced.
Yes, so imagine autoimmune diseases is when your body fights itself. Imagine, have you heard of like
Lupus.
say that again?
Lupus.
Exactly, that's what I was gonna say.
Yeah.
So lupus is an example of the body um producing a response to itself. Okay, it's fighting itself, and that actually, the body can do that quite a lot. Imagine in times of when I mentioned earlier about eating peanuts and anaphylaxis, allergy reaction is actually the body trying to fight something that it thinks is trying to trigger it. But that's a bit complicated. Let's not get into that. I've made it a bit complicated. Let's stick with the lupus, but
Right.
yes, autoimmune condition. The body is producing molecules which attack itself.
Mhm.
So that's what's happening in type 1 diabetes.
So the difference between type 1 and type 2, I've often heard that type 2 can be reversed, but type
Yes,
1 cannot. Is that
exactly.
true?
Yeah, and if you think about it, that's exactly the case. So type 1 diabetes, you can't reverse the autoimmune effects. The body has already damaged its cells that it needs to produce insulin. But with type 2, by maintaining a diet that's low in sugar over time, just as your body built up resistance to insulin, it can go back to responding to insulin by having smaller amounts.
So, so would it would it be in a sense of neglect why people left from type 2 to type 1?
So there's no way of moving from type 2 to type 1. They're completely separate. If
Or they're
you
separate?
Yes,
So it's
so
not a stage, only from pre-diabetic to type 2, but from 1 is just
exactly. They're
so you don't
two.
basically develop type 1 then.
You can't develop, you can't get type. That's why I say in children, because that's when
Yeah.
you notice it in early life, because it's not to do with the lifestyle, it's to do with the body responding to it.
Oh,
Whereas
oh.
type 2, it is confusing the way they've named it, but
Yeah, because I always thought that, oh, pre-diabetic, type 2, type 1. And I always try to wonder,
yeah.
what's the difference between type 2 and type 1? Because pre-diabetic, type 2, then type 1. How does that
Yes,
make
does it
sense?
make sense? No,
So,
exactly.
so, so now you're saying to me now that is totally two different things.
Yes,
Basically.
imagine a line down the middle. You can't cross over the line you can't cross from type 2 to type 1.
Ah, no, that makes sense. You see, that is the reason why my podcast is around because
Yeah,
it helps to teach.
absolutely.
Yeah, there are many podcasts out there, and yeah, but I want to be into that number that to help people to really
Yeah,
learn about their health because your health is your wealth.
exactly.
I can remember there was a question asked, and it's a famous question today. An interviewee asks Bob Marley about riches, and his reply was, his riches is life.
Mm,
You know what I mean? So once you have life, you have
mm,
everything. And some people would work night and day, blood, sweat, and tears, right? And
right,
at the end of the day, they get sick. They're spending all that money that they work back into their health.
right,
But if they had spent less time working night and day and take a little bit of time in their health, they probably wouldn't be ending up spending back what they earn in their health.
right.
So I think people need to, you know, and I have a friend, I I don't want to call her name because I don't know, she never give me the permission, but she listened to the podcast and she know herself. Sometimes I will send her some because since I lost my mom, I have some very, very important people that comes in my life. And I appreciate them a lot. I may never said that to them, but I appreciate them a lot. They know themselves, you know. But I often send some tips to her where diabetes is concerned, because I really want her, because she have type 2 diabetes. Oh, she got so much complication. I can't even understand how she once survived with so much complication. But, so I ask these questions, so that people can really listen and learn. Um, so as we come to a close, I normally have a closing and an opening tradition, but God forgive me, I totally forget the first one, um, which was to pray. I normally pray before I start my podcast.
Mm,
But the second one is I normally ask the guests to leave an encouraging words for the next guest that coming up, not knowing who is that guest. And
mhm.
I get this from Stephen Bartlett, but he asks a question, but I ask to leave an encouraging word because when you go into a health crisis, you need something to encourage you, right? And the guest that left are encouraging for words for you, not knowing that you was coming on, is Satwan Singh.
And he said, cherish each moment with others and hold on to whatever makes you happy in life. Live to love and love to live. That's his encouraging word to you. Um, I won't ask you your encouraging word because I don't want anyone to hear. So I would ask you to send it to me via
Okay.
text.
Okay.
So you get
Yeah.
time to think about it.
Yes. Yeah. Okay. All
Because I
right.
see like, oh, what am I going to say now?
Yeah. Exactly. After something like that, that's powerful. Okay.
Yeah, yeah. James, you wouldn't even know how much I really appreciate you taking this time out. It means my channel a lot and it means a lot to me. I am hoping to grow my channel in advanced amount of subscribers to
Hmm.
achieve what I really want to achieve through my channel. And that is to help people. And that's my main motive for this channel. I don't want any fame. I don't want any money because whatever even I earn on YouTube, I will be giving it out also back to the channel. You know what I mean? So it's not about that. It's about helping because my mom was a selfless woman
Mm.
and she taught me how to give and share. So that's my main purpose of this channel. So it means a lot that you come on.
No, thank you honestly for I've been very bad at responding. I'm sorry because
Listen, I understand you're a
like,
doctor, you're in the field,
yeah,
and I understand.
it's that I was at work today. I was in the hospital, so it's just a very busy time. But yes, I mean, by all means, thank you for having me as well. It's been a pleasure, and never know, might be back one day if
I would love for you to be
if
back. I
if
would
the
love for you to be back.
capacity. All
We
right.
could discuss some more stuff, but you let me
Yes.
know your availability and we
Yes,
can
of
arrange
course.
something. All
Yeah.
right?
So
And take
happy.
care and all the best in your career.
Thank you very much. All
All
the
right.
best to yourself too.
Bye bye.
All right. Thanks, Brian.